Good morning. Today we are going to learn about hepatitis, how it is transmitted, and ways we can prevent transmission by breaking the chain of infection. Hepatitis is inflammation of the liver. We will just discuss the 5 main viral causes today, but it can also be caused by bacteria, alcohol, chemicals, drugs, genetic disorders, or an overactive immune system. Hepatitis A is a very contagious, vaccine-preventable liver infection caused by the hepatitis A virus. It is spread when someone unknowingly ingests the virus through close personal contact with an infected person or through eating contaminated food or drink. Food supply can become contaminated with fecal matter from poor hygiene, infected persons handling food, crowded conditions, or poor sanitation practices. Symptoms can last up to 2 months and most do not have long-lasting illness. People are most contagious the week or two before symptoms even start to show. The best way to prevent hepatitis A is to get vaccinated, wash your hands, and use safe food handling practices.
Alright, so what is hepatitis B? Hepatitis B is a bloodborne pathogen that can cause illness ranging from acute to chronic hepatitis. It's spread 3 different ways: perinatally, when it's passed from mother to the child during birth; percutaneously, through exposure to blood of an infected host; through needle sticks or IV drug use; and mucosal exposure during sexual transmission, where breaks in the mucous membrane are exposed to bodily fluids of the host, including blood, vaginal secretions, semen, and saliva. For acute hepatitis, some possible symptoms include anorexia, lethargy, nausea, vomiting, skin rashes, diarrhea, constipation, malaise, fatigue, myalgias, arthralgias, flu-like symptoms, right upper quadrant tenderness, clay-colored stools, dark urine, decreased taste and smell, jaundice, pruritus, and splenomegaly. For chronic hepatitis, these would include anemia, bruising, bleeding, spider angiomas, palmar erythema, gynecomastia, lymph node enlargement, hepatic encephalopathy, ascites, hepatomegaly, and jaundice. Okay, so those who are at risk for contracting hepatitis B include those engaging in unprotected sex, healthcare workers, IV drug users, those who are exposed to blood or blood products, and those who are on hemodialysis. For prevention, we have a vaccine available that can be given post-exposure, and it's important that those living with hepatitis B infected people and those at a higher risk of getting hepatitis B get the vaccine as soon as possible. We can also use standard precautions to protect ourselves in case of contact with blood and bodily fluids that are infected, and we want to make sure that we're using barrier protection during any sexual act. We also have clean needle exchange programs that help decrease the rates of hepatitis B infections in the population by decreasing the amount of contaminated needles being shared. Okay, so another little important fact about the hepatitis B vaccine is that it can help decrease the risk of transmission from mother to child during birth, and a study even showed that 9 out of 10 children infected at birth will become chronically infected if they are not vaccinated against hepatitis B.
All right, so what is hepatitis C? Again, it is a bloodborne pathogen, specifically a virus. It can cause both acute and chronic hepatitis. Chronic liver disease and liver failure are most commonly caused by this type of hepatitis, hepatitis C. How is it spread? By high-risk sexual behaviors, including behaviors like having unprotected sex and sex with multiple partners. It can also be spread via needle stick, IV drug use. Needle sticks can occur in a work setting. Exposure to any blood or blood products, and by perinatal exposure, which is mother to child during childbirth. And a lot of these are very similar to hepatitis B. Who is at risk of contracting hepatitis C, and what can we do to prevent this? Those at risk include healthcare workers, IV drug users, those engaging in unprotected sexual acts, the homeless population, and those who receive medical care. What can we do to prevent this? If we improve and increase screening of these at-risk populations, we can identify those who are at risk and educate them about prevention. We can also identify those with hepatitis C and provide treatment. People born between 1945 and 1965 should be screened for hepatitis C because they would have received medical care in a time where there wasn't routine screening for this virus. Improving access to treatment is going to help prevent the spread by treating people with the disease so they can't spread it. And the use of standard precautions in the workplace can stop the transmission of hepatitis C virus from patients to workers. Some barriers to receiving treatment for hepatitis C include addiction and substance abuse, comprehension level of those who are infected, homelessness, the actual concern about adverse effects, medical comorbidities, mental health disorders, past non-adherence to medications or appointments, and patients' level of concern about hepatitis C. Okay, so interesting fact. I was in San Diego a couple years ago visiting a friend, and they actually had just undergone a big public health effort to wash the sidewalks and streets of San Diego because of their large homeless population and the fact that hepatitis C was endemic to that population, and they wanted to stop the spread. So they did just mass city cleaning. All right, so hepatitis D is a single-stranded RNA virus which cannot survive by itself and requires hepatitis B to serve as its outer shell. So, because of that, only people infected with hepatitis B are susceptible to the co-infection of hepatitis D. And that would also mean that treatment for hepatitis D is basically treating the hepatitis B because it can't live without the B. All modes of transmission and prevention practices for hepatitis B also apply to hepatitis D for this same reason.
Hepatitis E is transmitted by the fecal-oral route, usually through contaminated drinking water. It's most common in developing countries with inadequate water supply and poor environmental sanitation. Many people with hepatitis E do not have symptoms of acute infection, but pregnant women and those who are immunosuppressed are more likely to experience severe illness.